Hi everyone! If you're watching this video, you and or your family are interested in learning how to age in place successfully. My name is Cecilia Ramos. I am a doctoral candidate for the Occupational Therapy program at the University of St. Augustine for Health Sciences. Let me begin by introducing occupational therapy and its role in aging in place. Occupational therapy is a profession that focuses on assisting people in developing, maintaining, and or regaining skills necessary to perform everyday tasks or meaningful activities. In this profession, occupations are referred to activities you occupy your time with, whether those are self-care tasks like bathing and teeth brushing, socialization, school tasks, hobbies, and much more. Aging in place can be described in many ways and has different meanings to everyone. So for the purposes of this video guide, I am defining aging in place as an older adult choosing where to age, that is, with family, friends, their spouse or partner, and at the place of their choosing, whether that is in an owned or rented home, apartment, or retirement home. The skills and resources that will be shared in this educational video guide will assist with performing everyday tasks safely in the place of their choosing. In this video, we will discuss various devices that can be used to support your participation in these valued activities while promoting independence. I will discuss some equipment that can be used for meal preparation, feeding or eating, bathing, dressing, and in the bedroom. There will be a short demonstration of these devices and some small clips to show you how these devices can be used. There will also be a document with resources for finding these devices and others that were not mentioned in this video. Meal preparation can be an important activity for many people, whether it's to support socialization, relaxation, or creativity. Several factors play into preparing a meal. This activity also requires cognition and physical movements from both our upper body and lower body. So, there are various ways to adjust this task if you're experiencing difficulties. Whether it's using strategies to conserve energy due to increased fatigue while standing for long periods of time, or using devices that will make up for or assist decreased hand grip. Let's talk about Dyson gripping material. This material has many uses during meal preparation and other tasks inside and outside the home. They are sold in various shapes and sizes, depending on your needs, or you can purchase a reel of it and cut it into your own shapes and sizes. For meal preparation, this non-slip material can be used to prevent anything from slipping, like your cutting board. It can also help with opening jars and gripping utensils. The rocking tea knife. This knife has an ergonomic grip and is made for people with limited hand grip and or restrictive wrist and arm movements. With this knife, you're able to cut food items by rocking the knife forward and back, instead of pushing the knife down with your arm and wrist as you would with a regular knife. The one-handed cutting board. This cutting board has a few versions. Your selection would depend on your specific needs and preferences. This device can be used if you have limited movement and or strength in one upper extremity over the other. This cutting board can assist you in holding food items in place while you are cutting these items. Some have a vise that can hold food items or even jars to assist with removing lids. Others have a raised edge that can assist with ensuring food items do not roll around or move while you are cutting. Jar openers. There are also several variations of these. Here, I am suggesting a plastic one with grippers on the inside to aid in gripping the lid to open the jar. This device can be used if you have limited grip strength. Here are the other variations of jar openers. Here are some tips to conserve your energy while participating in meal preparation. You can conserve energy while preparing a meal by sitting during most of the prepping, gathering all the items required to complete the task, and keeping them close by. You can sit while cutting vegetables or any other food items. Standing for long periods of time can exert a lot of your energy, thus, sitting during most of the meal preparation will decrease fatigue and also decrease the probability of a fall. Another tip to consider is sliding heavy items across the counter instead of lifting or carrying these objects. For heavy appliances, you can use sliding boards, like the one pictured here, to assist in sliding these items across a large countertop or table. For many, eating is not just about nutritional intake. There are routines, habits, and sometimes religious aspects to having a meal. There can also be some socialization occurring during mealtimes, so it is important for anyone who is sitting at the table to feel confident in their abilities. Here are a few options that can support you while feeding. Weighted utensils. This type of utensil has a weighted grip to provide stability with hand movement while feeding for people who have tremors. The weigh provides a stimuli or a cue to the brain that the hand is being used, allowing the user to calm their tremors and feed themselves. Usually, these are sold with thicker grips, sometimes called built up. There are also built up utensils without weight that can be used for people who have limited grip strength or limited hand mobility. Both weighted and built up utensils can be found as spoons, knives, and forks. A curved spoon allows for easier self-feeding for those with limited wrist and or neck mobility. This utensil allows you to bring food into your mouth without changing the orientation of your spoon or your neck or head. A universal cuff can be used to hold several items when the hand is limited in mobility. This equipment can be used on utensils while self-feeding. There are several styles and they can be made of many materials. Here are some examples. Scoop plate. This plate has an elevated edge on one side of the plate for individuals who have trouble scooping food with utensils. This can be due to limited wrist mobility and or limited hand manipulation. Some of these plates have a suction cup feature to provide stability while scooping. There is also a plate guard that provides the same concept as the scoop plate. However, this guard can be added to most of the plates you already own. Nosy drinking cup. This cup has a space cut out to fit an individual's nose, allowing the individual to take a drink without having to tilt their head back. This cup is for individuals with limited head or neck mobility. Positioning. While considering any of the equipment mentioned, you should keep in mind the positioning of your body and positioning relative to the food and table. Studies have shown that improper positioning can reduce swallowing functioning and increase the risk of aspiration. Aspiration occurs when food goes down the wrong pipe being your trachea, where air goes into and out of your lungs. Having food in your lungs can lead to pneumonia and can become fatal. A way this can be prevented is by positioning yourself properly. Here are some pictures to depict proper positioning while eating. You should be seated on a firm surface, feet flat on the floor, equal weight bearing on both glutes or buttocks, sitting up straight, able to rest both forearms on the table with elbows bent. This means not lifting your shoulders or slouching over the table. Your head is upright and your chin slightly tucked down. You may use pillows or towels to assist in creating the proper positioning, especially when deciding to eat while seated in bed. The bathroom can be one of the most hazardous places in your home. This can be due to the size of the room, this environment becoming wet and slippery, the layout of the sink, toilet, and shower, or the physical limitations the individual has, like limited strength or endurance for standing tasks. Studies have found that most falls in the bathroom were related to transfers in and out of the bath and shower, and in and out of the toilet, which can lead to a range of injuries. Here are a few things individuals may do to create a safer environment in the bathroom, prevent falls, and promote independence. Grab bars. When professionally installed, grab bars are best to maximize safety when navigating the bathroom for minimal support due to limited balance. The placement for horizontal grab bars on the side wall of the shower or tub should be 34 to 36 inches above the floor. The placement of bars depends on physical and visual needs, so consulting with an occupational therapist or an aging in place specialist is recommended for optimal placement. Toilet seat riser. This is recommended for individuals who are experiencing difficulty with standing up from a lower toilet. This can be due to limited lower body mobility and strength. A few styles offer the same attribute of bringing the toilet seat up higher. One can go right on top of the toilet, has armrest to assist your upper body in pushing yourself up, and is supported by the floor. Another can be screwed onto the toilet seat to maximize safety, and another comes with armrests. 3-in-1 commode. This device can be placed at the foot of your bed or next to your bed to assist with incontinence episodes at night, creating fewer walking steps to limit incontinence accidents and prevent falls when walking to the restroom at night. This is recommended if incontinence episodes are occurring, and this should be consulted with your primary care physician or occupational therapist to see if this is a right fit for you. Now, if you remove the bucket, it could also be used over this toilet seat to provide support with armrests or as a seat riser if getting up from the toilet seat is difficult. It can also be used as a shower chair to provide seated rest breaks while showering or to complete your whole showering routine while seated. Shower chair. This device would go inside your bathtub or shower to allow for rest breaks while showering and minimize the possibility of a fall due to limited balance or the slippery and wet environment. If using it to complete a full shower routine, it is recommended that you bring all necessary items closer to you to prevent falls while reaching for items. You can find various tools to assist with placing all your items closer to you. Here are some options. Tub transfer chair. This piece of equipment is used when balance is limited or you have difficulty with a one-legged stance that is required to get your feet over the bathtub. The device comes over the wall of the bathtub, allowing you to sit down first and then bring your legs over the tub wall one at a time. Handheld shower wand. This device can be switched out from your original shower head. Usually, this can be done with some assistance, or you may hire a handyman to complete the installation. The handheld shower head is ideal when you are sitting to complete your shower routine. since you can control where the water goes for easier maneuverability and reaching difficult to access areas. The long-handled sponge. This device can assist with washing hard-to-reach areas while showering, like your feet, your back, or your bottom. This assists individuals who have limited flexibility or mobility or are unable to bend down. Non-slip material. These are a good option to instantly make the floor non-slip, especially in the bathroom where the floors are likely to become wet and slippery. This will assist in preventing falls. I suggest installing the non-stick stickers that can be taped to the floor. They are less likely to move and usually stay on for a few months until having to reinstall them. I recommend installing these both inside and outside of your tub or shower. Another option is purchasing mats that come in non-slip. However, you should consider that the mat will be slightly elevated from the floor and may become a tripping hazard. Lighting. Ensure there is ample overhead lighting in the bathroom to minimize tripping over or bumping into items while navigating throughout. It may be beneficial to have a nightlight or a motion sensor light installed for nighttime toileting, as this will help guide you in turning on the light switch for the overhead light. Removing clutter and organization. For safe navigation of the bathroom, you should remove cords from the areas you walk through by using Velcro ties or a cord holder where needed. Be sure that every item in the bathroom has a place to be stored. This is done to limit tripping over items and assist in preventing falls. Energy conservation strategies. To conserve energy, you should pace out activities throughout your day. For example, do not save tasks with a high level of exertion until the end of the day. An example of an activity with high level of exertion is bathing. A combination of wet floors and fatigue can easily lead to a fall. Accidents can happen when reaching for items. Research has been conducted on the correlation between limited reach and falls. The research suggests that having limited reach increases the risks of fall occurring. Most stressing tasks require some balance and reaching for the task items, like clothing, shoes, and other accessories. Here, I will discuss equipment that can assist anyone with limited reach, allowing them to continue participating in these tasks independently. Sock aid. This device assists those with limited reach in putting on their socks. There are one-handed and two-handed devices. Here is a demonstration of how to use this aid. Reacher or grabber. These are available in different styles, including lightweight, folding, and rotating. However, they all complete the same goal: to reach for items away from you. Reachers assist people with a limited range of motion or limited reach due to arthritis or other conditions, helping them easily grab out-of-reach items. Dressing stick. This device can assist with putting on or taking off your shoes, socks, pants, and shirt, and zipping up clothing. Here is a demonstration of the various uses of this device. Shoehorn. This device assists in sliding shoes on and off without bending over. There are short and long-handled versions. The length depends on how limited your reach is when bending down to put on or take off shoes. Button and zipper pull. This tool supports individuals who use one hand to manipulate buttons and move zippers up and down. The device eliminates the need to use the tips of your fingers to manipulate the shirt and small button or zipper. The downside to this tool is that it cannot assist with aligning both sides of the zipper before zipping it up. Here is a demonstration of how to use this device. In this section, we will explore devices for the bedroom that can support mobility and sleep to maximize safety and comfort. Pillows are available to ease pressure and stress on the body, providing restful sleep. Other devices in the bedroom, like bed rails and step stools, ease your way out of bed and promote independence. Bed rails. Several designs have pockets to store items. Some are much longer than others. Your choice depends on your needs and space. These bed rails can be inserted under your mattress and sit on your floor to offer more support while getting in and out of bed. Step stools. This device is an alternative to bed rails and is offered in different weights and dimensions to suit your bedroom space and needs. This stool has handrails on either side and a step above the ground to ease getting out of bed and make it much safer. Leg lifter. This device assists in raising and lowering your legs for those individuals who have limited mobility, especially when getting in and out of bed. It is also helpful for hip arthritis or hip replacement. Body positioning with pillows or wedges. Some wedges available are to elevate your head to assist with opening the airway and preventing the tongue and soft plate from sliding backward, particularly with sleep apnea and snoring. Adjusting your positioning for better sleep will improve your overall health and well-being. I suggest consulting with your primary care physician before attempting. You can also use different wedges to elevate your legs to ease pressure on your lower back, and wedges to put between your hips to provide cushioning between the knees and reduce pressure or stress at your hips. Energy conservation techniques allow individuals to redistribute efforts to complete daily tasks that are most important to them. When using these techniques properly, you can minimize muscle fatigue, joint stress, and pain. These techniques will assist in saving your energy, promote independence, and ease some frustration from conditions that can take up your energy. I would suggest incorporating some of these techniques throughout your day. Pacing the task and taking rest breaks throughout the day. Plan and prioritize the day around completing the most important task first, and do not overplan your day. You can also reflect on times of the day when you personally have the most energy. For example, some people, especially with rheumatoid arthritis, feel stiffer and more fatigued in the mornings, but warm up during the day and may need to flip their schedule. Modifying the task by completing it while sitting, as discussed previously when participating in meal preparation. For example, gathering all your items and have a space where you can sit down to complete the rest of the meal preparation, like chopping, peeling veggies, etc. If you have support from caregivers or family members, you can discuss delegating tasks throughout the day. Using the adaptive equipment discussed in this video and others can assist with conserving energy. For example, sitting while showering, using the shower chair. Lastly, pursed lip breathing. When done correctly, it can improve flow of air into your lungs, releases trapped air in your lungs, keeps the airways open longer, relieves the feeling of shortness of breath, and promotes general relaxation. I hope you found some of these devices to your liking and have already thought of how you can incorporate these into your daily routines. You can adjust your task in many ways to help you complete it and feel fulfilled and confident in what you are doing. Any modifications you consider should be discussed with your doctor, or if you need more information to find more customized solutions for you, have your doctor refer you to an occupational therapist. They can provide training and further resources in your community to ensure any modification is right and safe for you. Thank you all for watching.